Hello friends, I am Dr. Viswesvaran, currently working as a consultant interventional pulmonology and sleep medicine specialist at Yahoda Hospitals, Yashoda in Hyderabad. So today we will try to explain to you about a few things about asthma. We all know that the asthma is a condition in which the windpipes of the body are narrowed by means of chronic inflammation. So generally it occurs in children as well as in youngsters, but it can affect people across all age groups, and even people who did not have symptoms in the childhood can manifest with asthma at much later in their age group. So in general, this asthmatic patients present to us with complaints of difficulty in breathing, and generally they are associated with some sort of a whistling sound or a wheezing sound with the breathlessness. But sometimes they can also present to us with a chronic cough, that is a cough lasting for more than 2 weeks duration, and along with the cough they can also have worsening of their underlying difficulty in breathing. In addition to this, the cough is predominantly seen during the night times and on exposure to either allergens in the form of any strong perfumes or even animal danders, or even for that matter painting works that are happening or the construction works that are happening nearby. And generally they occur as a episodic phenomenon. That means in between times they will be normal, but whenever a season changes or they are exposed to the allergens, their symptoms come back. So the best medication that is currently available for the treatment of the asthma is the inhalers. This is the safest and the best way to deliver the drug to the particular site where we want the drug to act. So the advantages of the inhaler is that it produces an immediate control of your symptoms. In addition to this, it also reduces the side effects which are associated with the oral medications, and there is a myth that using the inhalers will result in habituation of the inhalers or addiction to the inhalers, which is completely false. So if you take the inhalers as prescribed your practitioner for an adequate period of time and in an appropriate dosing, then it can produce a good control of your asthma and you can do all your day-to-day routine activities. In addition to this, we also encourage avoidance of allergen, like avoidance of dust, avoidance of excessive fragrance producing substances like perfumes, and avoidance of cold weather, and even avoidance of anxiety is very important because that can also worsen your asthma. In addition to this, amongst patient who has got a chronic gastroesophageal reflux or heartburn, control of your heartburn can also produce a symptom control of your asthma. Apart from the medications, we also have advanced procedures like bronchial thermoplasty, which can be tried in certain patients to improve the asthma outcomes. In addition to this, we also have a new set of medications which we refer to as the biologics, which can be used especially in an allergic forms of asthma, and they are found to have excellent results on selected subgroup of patients. So if you have any sort of these complaints of difficulty in breathing associated with wheezing, or a cough which is predominantly occurring in the night time, or if your cough and breathlessness is associated with allergic symptoms of your upper airway like running nose, nasal block or sneezing, do consult your pulmonologist nearby because your asthma can be effectively controlled. Thank you.